Assalamu alaikum friends. I hope so that you all will be fine. Friends, in this video I'm going to discuss about the last two main parts of the glycolysis. In my previous video, I have discussed about the important aspects of glycolysis, steps, regulation and energetics. In this video, I am going to discuss about difference in between hexokinase and glucokinase enzyme and inhibition of enolase enzyme by fluoride bulb. So let's start our lecture. Difference in between hexokinase and glucokinase enzyme. Hexokinase and glucokinase enzyme. Students, this hexokinase enzyme, it acts upon all hexoses. Hexoses means 6 carbon atom containing sugars. Glucokinase enzyme, it acts only upon glucose. Hexokinase enzyme, it is inhibited by glucose 6 phosphate. Glucokinase enzyme, it is inhibited by glucagon, hormone which is secreted by alpha cells of islets of Langerhans. Third point is it has high affinity toward glucose, while glucokinase having low affinity toward glucose. Okay students, so it has very low Km value, it has very high Km value. Km means Michaelis-Menten constant. It shows the affinity of substrate toward active site of an enzyme. Hexokinase enzyme, it acts upon all tissues, while glucokinase enzyme, it acts upon liver and pancreas. This hexokinase enzyme activates when blood glucose level it is very low. This glucokinase enzyme activates when blood glucose level is very high. So student, these are the main points of the difference in between hexokinase and glucokinase enzyme. This hexokinase enzyme, it acts upon all hexoses. Glucokinase enzyme, it acts upon glucose. This enzyme, it is inhibited by glucose 6 phosphate and this is inhibited by glucagon. It has high affinity toward glucose, it has low affinity toward glucose, so that's why it has very low Km value, it has very high Km value. It acts upon all tissues, it acts only upon liver and pancreas, and it activates when blood glucose is very low and activates when blood glucose level is very high. So students, now coming toward the inhibition of enolase enzyme by fluoride bulb. Inhibition of enolase enzyme by fluoride bulb. Students, this fluoride bulb, it is used for the estimation of glucose in plasma. This fluoride bulb, it is composed of sodium fluoride and potassium oxalate with the ratio of 1:3. This sodium fluoride enzyme, it inhibits enolase enzyme, and this potassium oxalate, it acts as anticoagulant. Students, basically there is a formation of the complex fluoride, phosphorus and magnesium ions complex. This complex, it gets attached to the site other than active site of enolase enzyme, and through non-competitive inhibition it is responsible for the change in conformation of this enzyme and helps in the inhibition of enolase enzyme and all the steps of glycolase enzyme gets inhibited, and this act as an anticoagulant. Students, if we do not use fluoride bulb for the estimation of glucose in plasma, then blood glucose level, it will drop down 5 to 10 milligram per deciliter per hour. So that's why the fluoride bulb are used for the estimation of glucose in plasma, and this is composed of sodium fluoride and potassium oxalate with the ratio of 1 to 3. It inhibits enolase enzyme and it acts as a anticoagulant, and through non-competitive inhibition they form a complex that gets attached to site other than active site and responsible for the change in conformation of enzyme, and in this way they inhibit enolase enzyme in all steps of the glycolysis. Okay students, if you have any query related to this topic and previous topic, you may ask in comment section. Keep watching and thank you.